Hi, Sherry. Nice to meet you finally. Hi,
Yeah.
Ashley, finally.
Hey, beautiful Toni. Yeah.
Look, I borrowed your backdrop. So I'm
Yours is really good.
oh, you're very kind. Thank you.
Let me double check. We need to solve the technical thing first. Let me
Okay.
check it if everything good. And
The
then we
great-
can start.
The great thing is we can see you, you're here, your sound is good, your light is excellent, and we're
Did I
actually
turn down my light at all? Ashley, is my light too bright? I got the ring light for the first time.
it's perfect. We're actually live already, Sherry.
Yeah, I know. I
Okay.
check it out. So I just want to make sure everything okay, because the one we use it for the Chinese audience, and it's been updated all the time, and only a couple of weeks I didn't use it, so now a little bit confused, so I need to make sure everything good.
You're a perfectionist. You have to do what's necessary.
Okay, so actually we are already live, and today not only we are in Chinese platform 小鹅空, we are also live stream on YouTube and LinkedIn. So we have me doing an interview with Dr. Toni, and there is a couple of other my colleagues working on the other computers. So 3 different platforms at the same time doing live.
Wonderful.
Yeah. Well, we're so happy to have you. So now we still have 4 minutes. So usually they come at 9. We still have 4 minutes just to have a chat. I'm so happy to have you. And like after I read your articles and so many defense and talk to me is that when the live stream I'm gonna be there, and then in Chinese live stream you can send a gift, and they said I'm gonna send big gift. I said, so sorry, we use this platform, we cannot do that. I said next time we're gonna invite Toni, like hopeful she has time, we can do offline like an event, so in that time you can meet her. So
That would be great.
yeah.
Wonderful when we can do things in person again.
Yeah, that's true. But I know you have extreme busy schedule, right?
I do. I work full time, as you know, as a reconstructive surgeon. I also have 2 young kids. I have many other activities that I do, but I think events like this, organizations like this, I volunteer my time because I think it's important. And as much as I do miss in-person events, I think doing it virtually really allows us a potential to reach people who otherwise wouldn't be able to join us in person. So
that's true.
I'm very happy to be here, and thank you for inviting me.
Well, we are so thrilled to have you here. And like the breast cancer is really like last year when we doing every year we have the biggest event called the Grand Impact Award. Basically, we gave last year the social impact award gives to one breast cancer survivor, and called Xiong Beirou. She survived from breast cancer, and then she organized an organization. There is an organization, and then there's so many patients. We can say patients. They all have breast cancer, and then they encourage everybody to fight with the cancer. And that's the last year is the first time I feel, wow, there's breast cancer is not far away from us. Yeah, that's the first time.
Absolutely. I think I think most of us, if not all of us, have had a family member or a friend who has been somewhat touched by breast cancer. So you're right, it's not far. We're living with it. And I think it's an important topic. And I think that's why I do a lot of breast health advocacy work, because I think it's important to make sure that this is not a taboo topic that we, do not discuss in public. I think it's amongst us. And I think it's great that we can use opportunities like this to develop further awareness.
That's why we have today's live stream events. Okay, it's 9:00.
Perfect.
Okay, so
we're very prompt. We start on time.
Yeah. Okay, so good evening and hello everyone. I believe all of you know me and WeWorkingWomen. I meet with you online every month, sometimes more than once. So WeWorkingWomen is doing transformational changes start from last year. And so before we start, I'd like to introduce a little bit about Celebration and WeWorkingWomen. Celebration is a women-led tech company based in Toronto, and we are coming from a community-based platform called WeWorkingWomen, and it's being the 7th year this year. We are a platform that focus on overseas Chinese women, and we have lots of academy courses, live stream events like today, and we have membership of different clubs. So if you want to know more, you can always reach me via WeChat and the email. And as we all know, every month we have a theme. In March, the theme is women empowerment. So in this month, we've invited many wonderful, amazing women leaders to come to our platform to share their experience, their stories, and their inspiration. And tonight, we are very excited to have Dr. Toni Zhong here. So say hello to everyone, Toni.
Hello, everyone. I'm Toni Zhong, and I'm delighted to be here.
Okay.
Thank you for inviting me.
Thank you, Dr. Toni. Dr. Toni's story has been introduced to the WeWorkingWomen audience via our WeChat and the LinkedIn platform. And Toni, the first thing, I'm so relieved. I don't need to read your bio today. There are so many words. I don't even know what that means. So I checked the dictionary for that. When we published your article, I'm so happy. I don't need to read that. So Toni, you are a surgeon. Oh, there's, sorry for that. There's somebody. Yeah, okay. Yeah, so Toni, I'm so happy there's we invite you here because I prepared all the stuff and then I just check it out. So we are so happy to have you here. I don't need to read your bio, and then this is the wonderful things. Otherwise, I'm gonna be really, really nervous about that. So Toni, we know you've been doing so many things, like you are the surgeon for breast reconstruction, and then you are the expert on breast health and the women's health. And before we started, we mentioned about breast cancer is the #1 cancer for women. And then we are, before, like we said, we are feel that far away from them. And like we don't know anything about it. But we know it's serious, but sometimes we are even embarrassed to talk with our doctor. Sometimes, the doctor, if it's a male doctor, it's even worse. So today we have you here, and then we have you, you are the expert. So we're gonna ask all the questions we have. And I think our audience gonna have so many questions too. Yeah. So they
answer all the questions that come this way.
Yeah. And so first question I want to ask is about for the women's for the breast cancer, what exactly happened? Like our body, like when we have it, like what we gonna do with that?
So just to begin with, how breast cancer starts is we have normal breast cells, and through whatever trigger, whether it is an environmental trigger, which is most of the time, or through a genetic mutation in the DNA, it causes the normal breast cells to undergo a series of cancerous changes that we call the lignin transformation. These cells, once they become cancerous, then can divide and grow until they become a breast tumor.
Okay.
Now, your other question is, how do we know when this is happening? So you're right, it is a #1 cancer in women. But the positive side about breast cancer is that it is these days usually caught early, because unlike some other tumors, breast tumor stays localized. So it stays in the breast, it grows inside the breast. And only in very late stages or in the very rare aggressive types can it spread widely through your body. So most commonly, we can detect breast cancer within the breast when it's still localized and it's still operable.
Okay. So what the good thing is, majority of the time, if not late stage, so it stay in the breast. It's not goes to like the other tumors, goes to the other part of the body. So that's the good side of the breast cancer.
Correct.
Okay. So what is it preventable for the breast cancer?
So in some cases, it is preventable. So, now we understand more and more about genetic causes for breast cancer. We know that although it's still relatively uncommon, but 10% of breast cancers, so small fraction, but 10% are caused by known genetic mutations. So probably the most well-known story is the Angelina Jolie story.
Okay, yeah.
Right? So someone who knows through genetic testing that they carry a particular gene that predisposes them to developing breast cancer. And nowadays, women can readily ask for genetic testing. And so you get the panel of genetic testing, and it gives you information on if you by any chance are a carrier for this gene. So Angelina Jolie had the most well-known type of genetic mutation called the BRCA gene. So we know people who have the BRCA gene have a 50% chance of developing breast cancer in their lifetime. So for patients like that, I think knowledge is power, information power. So to know that you have that gene gives you the power to do something about it. So to prevent it. So you can talk to your surgeon like myself and other breast surgeons, and you can opt to preventatively remove your breasts and where my job comes in is I do the reconstruction.
Okay.
We can't remove 100% of your breast tissue, but we do a good job, and we remove about 90 to 95% of the breast tissue that lives in your breast. And we do reconstruction at the same time. And that dramatically reduces your chance of having breast cancer. So that's probably the most powerful way to prevent breast cancer if you're one of those genetic carriers.
Oh, okay. And so I received a letter from the, I believe the government said, because I'm over 50 already. This year I'm 52 for the test, for the breast checkup, but I haven't to go to check it out. I think like when I said I'm gonna have an interview with you, I said, for sure, I'm gonna make the appointment to do it. But before really, I just feel I'm too busy, but didn't take it seriously. So you talk about the test, Angela did it. Yeah, that's different from what we're gonna do, like in Canada, in Ontario. Yeah.
Correct. So in Canada, in Ontario, if you have a very strong family history for breast cancer, you can ask for genetic testing. Okay. But that's for people who, are suspected to have the gene, which is a small percentage of the population. But the thing that you're referring to is what we call breast cancer screening.
Okay.
Breast cancer screening is probably the most powerful way of detecting breast cancer early. In Canada, in Ontario, we start screening women at the age of 50.
Yes.
We recommend that you get screened with a mammogram or ultrasound every 2 years. In the United States, in many states, and many places in Europe, they actually start screening at age 40. And I think that there's really a good, strong body of evidence out there that women starting at 40 probably should get screening.
Okay.
And the value in screening is that the cure rate for breast cancer is totally dependent on how early you detect the cancer. So the earlier you're screened, the earlier that you detect the cancer, the better your prognosis. So Sherry, if you go and get, if you respond to this letter and go and get your screening, I would be very pleased. And that would be a very positive outcome from tonight. Is I encourage people not to ignore their health. I totally understand we are all very busy. In fact, I would say that physicians, even though we went to school for so many years and we're trained to educate other people on taking care of their health, their bodies, we're probably the worst, most negligent people in taking care of our own bodies. But I think it is very important for us, for women, because it is the number one cancer that we get as women.
Yeah, for sure. Definitely. I'm going to book that appointment, because sometimes I just feel like I exercise myself, doing everyday exercise and keep the shape and eat healthy as much as I can. But just like what I mean before, like we feel it's serious, but it's far away from us. That's just not in our head. So I'm gonna be do it right away, like to book it.
Thank you.
And Toni, you said you're gonna show us how to properly do an exam by ourselves, right, for the breast. And can you show us now?
Absolutely. So I went and borrowed this. So I teach medical students how to do the breast examination. I teach at University of Toronto. So we have this silicone model that we use. This is what we teach medical students, but I'm going to teach everybody here who's watching. And I teach this to I get invited to public speaking events, and very often women are interested in how to do the breast exam. We hear about it all the time, but you're right. Nobody actually takes the time to teach you how to do it. So before I get to the silicone model, though, I have to say that the breast exam is composed of two parts. The first part, before you even touch the breast or do the exam, is inspection. So visual inspection. And I recommend to my patients, to the medical students, to women, that the first part is visual inspection, where you should be disrobed from basically collarbone all the way down to your belly button. You should be standing in front of a well-lit area in front of the mirror, and you should look at the breasts, because some of the early changes of breast cancer are skin dimpling. So skin being pulled in, and changes to the nipple. So a very early sign of breast cancer is the nipple itself inverting, okay? Or skin being dimpled in. Because what happens with the tumor is that it can pull in the nipple if it's located behind the nipple, or it can just pull in any parts of the skin. So visual examination, front, side, the other side. And if you are large breasted, then you want to lift up the breast to examine the undersurface, right? You're small breasted, you can see the entire surface area of the breast. But if you're large breasted, then it's a good idea to lift up the breast and examine the undersurface. So inspection is number one.
Okay.
Then second part is actually touching and palpating. So you have to understand the border of the breast, okay? And what you do is I teach people to use the middle three fingers.
Okay.
And use the finger pads. So the fleshy part of the finger, not the tips, but the fleshy part of the fingers. So you use those three fingers, and we do a circular motion. Okay. And you do light pressure to moderate pressure to deep pressure. You go all the way along. You start at the top, start like near the chest plate, going in circles. So again, light pressure, moderate pressure, deep pressure. You keep traveling. Don't lift up your fingers, and just keep going in a straight line like this. It's kind of like mowing the lawn. You don't want to do anything. And then you go up. So this is called the vertical strip method, okay? Because we're going in a vertical strip, circular motion, and you feel, your fingers can feel 1 to 2 centimeters of a lesion. So your fingers are actually very sensitive. I bet you that if you do this regularly, you'll be your own expert, and you will pick up breast cancers before your doctor can. So you keep going in this way, up and down, circular motion. Okay. Never lift your finger off the skin so you don't skip areas. Keep going. And don't be shy. Don't skip over your nipple, because under the nipple is actually a common place for developing breast cancer. Okay. So you do this, and all the way along. So in this model, where we teach our medical students, we actually have hidden breast lesions. So we do this and we examine them, and they have to tell us if they feel anything, and they have to describe to us what they feel. Okay, so this model, I mean, obviously I'm the only one feeling it, but there's a mass right here that I can feel. And so you keep going, and don't forget that the breast is also on the side. So go all the way to the side. And the last part of this exam is your armpit, where the lymph nodes live. So with the same three fingers, you need to go under your armpit, and feel in there. That's where the lymph nodes are. And sometimes the lymph nodes you can palpate, like lesions in your lymph node, because the breast tumor can spread to the lymph nodes. So it's important to also examine under the lymph nodes. And you obviously do that to both breasts and both armpits to feel for the lymph nodes. Now, if you do a thorough job, the entire breast exam is probably anywhere between 5 minutes up to 10 minutes. It doesn't take long, but you should do it once a month. So first part is inspection. The second part is feeling. And sometimes, we all get busy, but I tell my patients in the shower, do this. Okay. It's a good place to do this in the shower. And you should probably do it around the same time of the month. So the same time in your menstrual cycle. Usually we say about a week after your period is over, because that's when your breasts are the most quiet, and that's when you will probably feel things. Now, if you do by any chance feel a lump or feel something that's not normal, then it's important to keep checking it. Sometimes it's very common to have like benign findings. So like a cyst, or sometimes people will say they've been diagnosed before with a benign adenoma. But benign things usually go away, or they can get larger with your menstruation and get smaller. But if you feel something that's there that doesn't go away after like a month or so, that feels really firm, that feels fixed, you should not ignore it, and definitely go see your family doctor, point it out, and ask for that to be investigated further.
Okay. So there's a first need to do like just check it out, like standing in the mirror, and then just checking all like all around all the breast, because the skin,
yeah.
And then start to do it like all, don't miss anywhere, like any spot.
Don't just be very meticulous and make sure you've covered the whole area.
And so should do it every month.
You should do it every month. That is how you will develop a true awareness of changes, is if you do it every month.
Okay. And then the best time is after the period.
About 1 week after the period.
1 week after the period. Okay. Yeah. So our audience should all remember the time and then the procedure, like from the beginning to the end. Okay. Yeah. And what else should we as a women keep in mind to stay healthy?
So there are things that we know that can reduce your risk for breast cancer. So I think you mentioned some of those things. So definitely exercise. And for breast cancer, especially, they found that if you can exercise 30 minutes a day to the point where you're actually breaking a sweat. So strenuous exercise, 30 minutes every day, reduces your risk for breast cancer. Reducing alcohol intake is very important. Okay. So, probably reducing to less than 2 glasses of alcohol a week is good. Too much alcohol consumption can increase your risk for breast cancer.
Oh, okay.
Okay. And then, it's hard to know with diet, but probably a healthy diet and just being healthy in general will prevent many different types of cancers, and also just promote just general health. Other things that one can do is, for women who are postmenopausal, a lot of women who are postmenopausal get a lot of benefit from hormone replacement therapy. But you should talk to your doctor, because if you have a strong family history for hormone replacement therapy, it does increase your risk for breast cancer.
Mhm.
Because hormone replacement therapy is high in estrogen. And estrogen is a very strong activator for the most common type of breast cancer, which is estrogen dependent.
Okay. Well, there are so many things, but alcohol you mentioned, like I think that's the closest one with us, because sometimes we like to drink a couple of wine just for relax. You
Absolutely.
said that like a 2 glass of wine a week, right?
About 2 glasses of wine a week. You know, if you're drinking 2 to 5 per day, that's too much. So alcohol is okay, but it has to be in moderation.
Okay. And you talk about exercise every day for 30 minutes. Are you suggest that any kinds of exercise or all the exercise, as long as sweat, that's a good exercise?
Yeah, for breast cancer, any type of exercise you enjoy doing to the point that you're increasing your heart rate, you're breaking a sweat. That is good. That is good for reducing your risk for breast cancer.
Oh, that's good. That's good one. So, because so many people, they don't like to jogging, or they like this, they don't like that. But if any exercise is good, so that's easy.
Good. Yes.
Yeah. So, Dr. Toni, what kinds of exercise you doing regularly?
Before COVID, I used to go to the gym a lot. I did lots of, before COVID, I found exercising to be a really great way to relieve stress for me, but it was also social for me because I would go to gyms and participate in classes. But ever since COVID, we're fortunate because we have a basement gym. It's not big, but it's in our home. And now I actually really enjoy doing like training on Zoom or just following my sort of fitness instructor. And because of my busy schedule, I usually only have about 30 minutes up to 45 minutes that I can do per day. But I wish I could say I exercise every day. I don't, but I try to exercise about 3 to 5 times a week. The other thing that has been really great for my health as well as for our family is that during COVID, we got a dog. So we're happy at home. So we really take a lot of walks with the dog. Even in the winter in Toronto, we did that. And that just allowed us to be outdoors and walking. And that's our form of regular exercise.
That's perfect. The dog. So you walk the dog or the dog walks you. Who knows, right?
Who knows? Exactly. Depends on the day. Depends on the dog's mood.
Okay. You shared in your interview that you talk to women a lot about the issue of women have acceptation about their body, right? And I think like in our audience, like if I said perfect body, everybody has a picture in their mind, what's its perfect body. And then we all think about it like there's always can be better.
Yes.
Like no matter how beautiful we are, we always think about that can be better. So tell me about you're talking a lot with the women and how to deal with this.
I think you're absolutely right. We all have our own insecurities, and I think it comes down to acceptance. I think acceptance comes with age sometimes, but I think acceptance also comes from, it comes from the inside, and in my practice, I talk to women who are unfortunately faced with the breast cancer diagnosis. And unfortunately, you're right. Most women that I talk to about doing the operation where we have to remove their breast for cancer and building it, most of the times I say, in the ideal world, what would you like your breasts to look like? And more than half of the women would say, the larger breasted women would always say, I want my breast to be smaller. The smaller breasted women would say, I want my breast to be larger. I do have patients who say, I'm very happy in my own skin. I just build me the breast that I have today. So I do think it really comes down to self-acceptance. And maybe all of us in some way seek perfection. And I think it's accepting that you're not perfect, but you ultimately have to love yourself and you have to love what you see. And I think it's about gratitude. So again, my patients are breast cancer patients. And, they'll say, I would do anything, to have accepted my body more before undergoing this. I wish I accepted my body more. And now that I have to actually undergo this major surgery, I wish I had the time to, enjoy my body, feel more comfortable in my skin. I think that everyone as individuals should just be more accepting of ourselves. We can always try to improve ourselves, but not have unrealistic expectations. Because I think when you have that, then you're really sort of doomed to disappoint yourself.
Yeah, I think that's the media or social media really influence a lot. And I can see so many young girls, and really when we look at them, I feel so beautiful, right?
Yeah.
And then when we talk and they just saying, oh, here, I wish I can be this, I think that really they wants to be perfect, like the magazine or social media, that kind of picture. That's really a big problem, I think, now.
I think it is a big problem now. And I think you're right. Social media definitely plays into the insecurities more because it paints a very unrealistic image of women. And I think women should know that the picture perfect model doesn't actually look like that in real life. Everything has been altered on social media, in print, and it doesn't define happiness. It doesn't define how fulfilled you are. So I think we need to find fulfillment. We need to find gratitude in everything, and not allow ourselves to be focused on small imperfections. And they're generally small imperfections that we can't change.
The one you just said, find that even that looks perfect, but not defined as a happiness and fulfillment. I think that's really where we should pursue on that and accept who we are and what we look like right now. And that's the most important thing. Yeah. So Dr. Toni, you are a plastic surgeon. So can you tell us what do you think about plastic surgery for aesthetic purposes? So many people wants to have a taller nose, smaller face, and enlarge their breast. And so now this kind of procedure seems to so common, right? And is there long-term risk involved?
So this is a very good topic, and I think we could delve into this probably for hours. Now, I'm a plastic surgeon. I'm a reconstructive surgeon. I do some cosmetic and aesthetic surgery. It's not the focus of my practice, but I do some. And I'm, cosmetic surgery is becoming much more mainstream. And not just cosmetic surgery, but different kinds of cosmetic enhancement. So whether it's just Botox or fillers, and then surgery too, you're right. And then cosmetic surgeries are very interesting because in the Asian population, probably the number one, number two, three surgeries are definitely, like you said, the Asian double eyelid surgery, rhinoplasty, so nose, oftentimes like jaw, and decreasing the kind of the width of the face. Those are big surgeries. In North America, it's more body. So breast, tummy surgery. In Latin America, it's more enhancement of the buttock. So buttock liposuction. So a lot of it is dependent on sort of cultural beliefs and cultural views of beauty. Now, I do not, I personally think that if you want to have a cosmetic enhancement, whether it's Botox, whether it's filler or surgery, and you have really educated yourself on that and done a lot of research and informed yourself of the surgery, and you've done your research in finding the right cosmetic surgeon for you, I think more power to you for doing that. So I don't think that cosmetic surgery is bad per se, but I do think that if you are going to pursue cosmetic surgery, you really have to think it through and do your research and make sure that you're choosing the safe operation, the right operation for you, and make sure you're choosing the right surgeon for you. Now, unfortunately, also in my practice, I see women who have gone elsewhere for cosmetic surgery in other parts of the world where cosmetic surgery is much cheaper. There are places now in Europe and in South America where a lot of Asians go, and for a fraction of the price that they would pay in North America, they have these cosmetic surgeries. And they go back to Canada and they have lots and lots of complications. So when you ask me about long-term health risks, yes, there are long-term health risks if it's being done by suboptimal techniques and under conditions that wouldn't be licensed to do in Canada. But I think that if this is something that if you've always wanted, let's say Asian double eyelid surgery, and you've thought it through, you've educated yourself enough, and you've met the right surgeon that you can trust, then I think that I'm not against that at all.
Okay, so find the right doctor and do the research before you do the thoroughly research.
Yeah.
Before you do it.
Yeah, and exactly. And make sure that you understand what the before and after pictures look like. And also I think that if something has always bothered you, and you think that this particular surgery will correct a facial feature or something and allow you to live a more fulfilled life, allow you to be happier, then I think that it's worthwhile to pursue it. But also beware that you don't want to fall into the trap of constantly chasing something. One of the pitfalls of cosmetic surgery is that it can be quite addictive for certain patients. It's not uncommon where I've seen a patient who says, okay, this is like the 20th cosmetic surgery that I have had. And a lot of times it's actually to breasts, because they don't want to accept that there's some asymmetry or something that bothers them. And then because once you've had it a few times, then you think, okay, well, I'm just going to go for one more to fix this. I'm going to just go for one more to fix that. And then you become in this cycle where you no longer really know what you want. And again, it's the pursuit of some unrealistic goal.
That's true. That's true. Like I watch, like in China, there is I forgot what's the name of the show. Like they doing the plastic surgery and they are addicted. They've been doing so many times and then they spend all their money and then like just like the one words you're saying, they don't even know what they really want.
And they don't really even know what they look like to begin with, because they have so many alterations that they no longer look like themselves. So I do think the best kind of cosmetic surgery is one that can make you a better version of yourself, but still you're yourself. You know, if you become someone else and you're no longer you, then I think that's a big problem.
Okay, so we talk about that. So Toni, I know you do so much work to empower the people around you and to be the positive role model, and you provide that you support to your patient, and then you mentor your students, and you are the active volunteer doing reconstructive surgery for the country, for the patient in Bangladesh and the other development country. And then can you tell us about the best kinds of role models like you've had?
So I think I was very fortunate in that all throughout my life, I think I've had role models. And I think that has really played a pivotal role in who I wanted to be. My father unfortunately passed away when he was 60 years old. So he was fairly young, and I was still just a resident training to be a plastic surgeon. But throughout my life, I'm an only child, but I looked up to my father. He trained as a general surgeon, and he has a very quiet disposition, but he's in his very quiet way. He is a very powerful leader, and he's so patient. He's scholarly. He was a great surgeon, and he had a great mind, and later on became a great scientist. So I think throughout my life, he was my single greatest role model. So from a very young age, I was fortunate that I knew I wanted to be a doctor. I wanted to be a surgeon like him. So that becoming a surgeon, becoming a doctor was an easy decision for me because of him. And then later on in my residency, when I was learning to be a plastic surgeon, I met a female plastic surgeon who then became my role model. I think I'm attracted to people who care about other people. So what attracted me to this particular female plastic surgeon was that just the way she was with her patients. You know, in the first 2 minutes that you would sit down with this doctor, I think you knew that she cared, that she was a compassionate person, but she was also highly intelligent. And that to me was the ultimate surgeon, somebody who's refined, who had amazing bedside manners, who cared about their patients, cared about her work, and cared about delivering the best outcome that she could for her patients. And she was a reconstructive surgeon. So I followed in her footsteps. And that's when I did a fellowship in breast reconstruction at Memorial Sloan Kettering Cancer Center in New York. I'm so happy that I met her during my training. And, you know, and it's because of her that I realized that I wanted to be the kind of surgeon that could develop really deep relationships with my patients and be there for them and be there for them during very vulnerable times in their lives. And I always knew that I wanted to do something very technical with my hands, and plastic surgery really gave me that ability to do very fine, technical, challenging procedures. So I'm just really lucky that I chose a career. I have role models that allow me to combine my passion for using my hands, but as well as using my mind.
Yeah. And when I ask you this question, because many of the women in our community are really looking to develop mentorship relationship with the women they admire. Can you provide just some advice? How do you like to be approached as a mentor? And what is the best way to develop the mentor and the mentee relationship?
Very good question. So I do have a number of not just females, but I have a number of medical students and even undergraduate students and residents who I mentor. I think it's difficult to put into words, a single quality or a single trait, but it's just how two people interact, right? And for me, what really builds relationships and understanding is just probably the longevity of our relationship. So I've had students approach me. One of the women that I have mentored for a number of years, she approached me when she was, I think, in grade 11.
Really? Grade 11?
She was in grade 11 at a private girls' school in Toronto. And she somehow found me because I think just through family friends. And she wanted to do medicine. And she, I think, knew early on, she was very bright, very, very bright. And so she knew she wanted to do medicine, but more importantly, I think she wanted to be a surgeon. And she knew that there were not a lot of female surgeons out there. So through various family connections, she just approached me. She emailed me, and she was very available. And I think we met for coffee one day. And it's just me. I like getting to know people. So I generally do not say no for coffee, and I have to know, I think what attracts me to a mentee is someone who is genuine, someone who is earnest, right? Somebody who has humility and who wants to learn. So, and I think she said, I know this is very early on. You probably don't take high school students, but I made an exception. And she actually came to my operating room and shadowed me. She stood there from 8 o'clock in the morning till 6 o'clock at night. She was fascinated, like truly fascinated. And then shadowed me numerous times and wanted to, sort of do research with me. And I spent the summer doing research with me. And now she is doing pre-med in California. And about 2 years ago, she came with me on one of the humanitarian missions that I did in Bangladesh. And I said to her, I said, you can come, like you won't be able to participate in any of the surgeries, but you can do lots of just kind of other work. So she helped, I think, take photographs, document, check patients in, do inventory. I like people who are just willing to learn, willing to help. And like I said, longevity of relationship. And I've now known her for a number of years, and I will probably continue to mentor her. And then when it comes time to applying to medical school or applying for residency spot, I will be her advocate because it's someone that I have a long relationship with, and I want to see her succeed. So I don't think that there is a single magic formula, but it is just about two people's personalities and what makes you trust in each other.
Well, that's a great story from a grade 11 started. That means she's really truly in it, right? Inspired, and that's a great story. And Toni, you have had like inspiring career, like we read it, and we are so proud to see a Chinese woman plastic surgeon be so successful in Canada and globally. Do you have advice on other women working to get the top of their field?
You know, I think that you have to, for everybody, I think you have a dream, you dream big. And then I think what helped me succeed was a lot of hard work. So, you know, I don't think any dream is too big, but I think it also takes a lot of time, a lot of effort, and a lot of commitment to get there. And I think along the way, it's important for people to recognize that you don't get to a position of leadership, or you don't become successful and every step is successful. I mean, there are many parts of my training, many parts of, you know, me getting to where I am, where there were barriers and there were setbacks and even sometimes failures. But just know that you have this ultimate dream. Despite the setbacks, you need to, I think you're better every time you overcome it. And it is a lot of hard work to get there. But I think that if you love what you do and you feel truly passionate about that dream that you have envisioned for yourself, then that's your ultimate goal.
I remember I talked to my coach because I have a big dream too, right? When I talked to him, and then he said, imagine what's gonna be like this dream come true. And then I described the picture of this dream comes to true. And then he told me one thing, the same what you say. He said, that goal is so good, but you need to enjoy every step to that dream.
Yeah.
So that make you a happy person. Otherwise, like you only see the dream, but if you don't reach exactly what you think, that means you feel like really disappointed.
Yeah.
And then you feel a lot of pain there. But if you every step to there, you enjoy it, no matter like what kinds of challenges you pass that. And that's the perfect like a step, like each step to that dream.
Absolutely. So like I said before, my dad was also always my role model. And my dad was very, very wise about these things. So when I was even a child, I remember he would always sit me down and say, what's your ultimate dream? And then I remember I would say to be a doctor. And he would say, okay, but what's your goal for this year? What's your goal for 5 years? And I used to think it was so annoying that he would make me do it. And now I think, you know, it makes a lot of sense. Yes, you create a 10-year plan, a 20-year plan. Today, there's tomorrow, there's next week. You need to drive fulfillment, not just at the 20 years, but every step of the way. So create some short-term goals, tangible goals, and then the ultimate dream, right? I think you're absolutely right.
Okay, so we started at 9 o'clock. Now we leave the time for the questions. Let me check it out. There's any questions? There's a Siwen ask, how does cancer feels like? a piece of rock
Mhm.
or something else? Thanks.
So breast cancer usually feels
Like,
right. Breast cancer usually feels, it's not like a rubber or a pea. It feels very firm. So yes, very firm, almost like a hard pebble. Not only is it firm, but generally it's quite fixed to something. So you try to move it around, it's not mobile. It feels like it's kind of attached to something underneath, which is, your muscle, or it can feel really attached to the skin.
okay. I remember there's some is if it's soft and some is hard, right? That's the what's the difference? And then which one is cancer?
So usually if it's softer and more rubbery, or more like, like the pea kind of consistency, softer, round, you can it's mobile, that's generally a benign, something that's not cancerous.
Okay.
But cancers tend to be really hard, very firm, and very fixed.
Okay. Okay. So I think that's answered Sue's question. And that's from Ashley said, some kinds of cancer, they say you can't see or feel. Are there other signs of symptoms of cancer we should look out for?
So breast cancer, thankfully, most of the times is something that you can either feel because it's a mass, or on ultrasound or mammogram, you can see.
Mhm.
So for breast, it's usually detectable that way.
Okay. Okay. And there's another question that I want to ask when you're talking. You said one have the cancer, breast cancer, and then you, as a surgeon, you remove majority of the tissue and then reconstruct it. And then is it like after that, is it still feels the same like what we have, or it's like just fake, looks so fake? I just want to imagine that. Yeah.
So we've come a long way in our ability to reconstruct. There are different ways we can reconstruct. So we can reconstruct breast using your own tissue. And the most common place we take tissue from is from your own abdomen. So we take tissue from your abdomen, and that's probably the number one surgery that I do, is we take tissue from your abdomen, we move it up to the chest. We have to hook up the blood vessels under the microscope, because tissue in its new environment needs to have new blood supply. Otherwise, it doesn't live. And when we use your own tummy, skin, and fat to build a breast, it feels very natural. It looks very natural.
Okay.
Sometimes we can also reconstruct using implants. So silicone implants. Now, silicone implants in some people can look very real. It doesn't feel as natural as your own tissue. Remember, after breast cancer and you've had to have your breast removed, you don't have sensation anymore. So the breasts are numb. So they don't feel like the way you touch your breast and you feel. They feel numb. And so to a patient who has implants in and has already numbness, that can be sometimes a very awkward feeling for people to get used to. But certain people, implants can look really quite real. And especially if we do nipple sparing, so we leave the patient's own nipples behind, sometimes you can't even tell that they've had a mastectomy.
Oh, wow. And I just wonder, like you said, if there is the first one use the patient's own tissue. So in that case, they still have the feeling or sensation, right?
No, they don't. So even though it looks very real, there's no sensation because the nerves are removed with the breast. Nerves travel through the breast, and when the breast removed, is removed, the nerves are cut. So
okay.
because of that, the skin on the breast is quite numb.
Oh, okay. That's we know. And there's another question. Is the breastfeeding good for the breast health? Breastfeeding, is it good for the breast health?
Breastfeeding. Breastfeeding, it's a great question. Breastfeeding is excellent for reducing your risk for breast cancer. In fact, if you can breastfeed for more than 6 months or even a year, studies have found that it can reduce your risk for breast cancer.
Okay, that's good. So, and how old was the youngest patient you had for breast cancer?
It's very sad. The youngest patient that I have is a patient who is unfortunately 21 years old.
Wow, that's too young. That's too young.
It makes me so sad every time I have to see this patient in clinic. You know, she's 21. She's in second year university. And I think of other kids that I know that are in second year university. I think of when I was in second year university, you know, breast cancer was not on my radar. You know, you're in this, when I was 21, I was at McGill University. I moved out of home, was making new friends. You know, my biggest worry was probably, you know, what grade am I going to get on the next chemistry test? And this poor patient is worried for her life and having chemotherapy and surgery and radiation. And it is terrible that a 21-year-old has to deal with such heaviness in her life.
That's true. And we have another question said, somebody says that cancer cannot be avoided because it's from inside of the body. Is it true? Like they said, it cannot be avoided. Even you try to prevent it, it may happen to you.
It is unfortunately somewhat true. You know, I'll have a lot of patients who say, I've done everything I can. I eat so well. I exercise all the time. I have never smoked. I do not drink alcohol. I really take such good care of my body. It is so unfair. Why do I have breast cancer? And it is true. We don't know exactly what, there's no single factor that causes breast cancer that you can avoid. And because we don't know what myriad of factors there are that may cause breast cancer, you know, we because we don't have that knowledge, we just don't know what there is that the big list that you can avoid in your life to prevent you from breast cancer. So there is a little bit of truth in that sometimes with cancer, you just don't have an identifiable cause.
So we just need to take care of ourselves. And then
we know that can reduce your risk for breast cancer are the things that we can control. And those are the things that we can do something about.
Yeah, like exercise, don't drink too much, 2 glass awake. Yeah, those kind of things.
Maintain a good body weight.
Yeah.
All those things are very important.
Okay. And I have a question because I see like Jingwen ask about breastfeeding, like it's really good to prevent breast cancer. And then for those women, like we never have a kid, right? So is it like a high risk to have breast cancer?
No, not having had a kid or not having breastfed doesn't make you at high risk at all, but it's one of the modifiable things you can do if you had a kid and if you are able to breastfeed, is to breastfeed, but it doesn't put you at higher risk if you never breastfed or never had a child.
Oh, okay. So now I feel a little bit better. Like when you were just saying like breastfeeding is good, I said, okay. Yeah, I don't have kids and never also do the breastfeeding, right? So is it gonna be okay? So that's that's all the questions we have today for today. And thank you so much, Dr. Toni. I know you have crazy schedules, like you are teaching, you are doing the surgery, and then you are doing volunteer work, and then you're mentoring. There's so many different kinds of schedules, right, for you.
I think we're all busy in our own ways, right? I think all of us are just trying to live fulfilled lives. And yes, I do a lot, but this is an important part of what I do, which is, and thank you. And I like to thank Ashley for inviting me to speak. I think this is an amazing organization that allows me to connect to other women of Chinese heritage like me. And it's a powerful platform for me to use my voice to help other people look after their own breast health.
Yeah, that's thank you to give us like so many informations about breast cancer. And then at least now, like for me, I know I need to book it right away. That's the test, screen test.
Yes.
And then the same times when we have anything about any questions, like don't be shy, just talk to your doctor, and then do the exam every month.
That's right.
For yourself. So we want everybody, we want to pursue our happiness. The same time, we take care of ourselves.
Absolutely.
Yeah, and only when we're healthy, that's everything can be like a pursuit. Like that's healthy. It's really after the pandemic, we all realize like healthy body is so important to everybody.
Yes, exactly. It's a foundation. Without a healthy body, without a healthy mind, you just cannot live the life would just not be the same.
That's true. Thank you so much. And I'm truly enjoying the conversation with you. At the beginning, like we have some technical issues, but we solve it. And so thank you. And Dr. Toni, I think like in the near future, we may invite you to have the events to meet with our members. Like we can do it like in person. So that kind of conversation gonna be a lot of better. Yeah.
I love that.
Yeah, but today we can cover so many different cities, the members from different cities. Thanks again. So all the audience, and then I see there's let me just double check if there's very useful information. Ashley said, thank you, Toni. Okay, so good, like a good night, like for our audience, and good night, Toni. And I see you in the near future.
Sounds wonderful. Thank you, everyone. Good night. Thank you.